The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. Every week I will discuss health-related issues that pertain to our community. To learn more about my practice, go to drtommyo.com. That's drtommyo.com. If you prefer, stop by my office. It's located at 250 Patchogue Yaphank Road, Suite 16, East Patchogue, New York. Or give us a call, 631-980-8200. That's 631-980-8200. To my military family, I got your six. To my Masonic brothers, the light is bright. I have a special announcement. It's a grand opening and ribbon cutting. This is sponsored by the Patchogue Chamber of Commerce. The date is February 15th, Tuesday, February 15th, between 5 and 7 p.m. Ribbon cutting is at 6 p.m. So please come and join us. You can meet me and ask me questions and learn more about my practice. Now, I'd like to introduce someone I've known for a very long time. And we have a strong relationship, like a family-type relationship. We've known each other for almost 2 decades now. So I'm going to introduce Miss V.
Hi, Dr. O'Brien. How are you?
Welcome to the show.
Thank you so much for having me.
All right. Let's just say, how long have we known each other?
Oh, wow. We were about almost 20 years. You were my doctor, my daughter's doctor. We were colleagues together, and now I'm assisting you in your new venture, helping the community as well. We both have nonprofits.
Yes.
Yours is Help. Mine's called Lift, with me and my partner, and we educate and help the community. We have pantry, clothing drives, educational stuff, and assistance, just to name a few things. So we're doing good stuff.
That's great. That's great. This is what we're here for, taking care of the community through medicine and community outreaches. Miss V and I, we used to we were part of food and clothes drives up in the Bronx, and now we're taking that same services and bringing it here in our community. So we have the medical services as well as community outreaches.
Yep.
So today's topic, the importance of a history and physical. So what is a history and physical? The history and physical is also called an H&P. Again, history and physical. This is the starting point of the patient's story. This is where it all begins. This is the time when a true physician-patient relationship develops. The patient will explain their past medical history and mention their medications. The physician will perform a thorough physical. And this is something important that's not addressed today.
Oh, definitely not. I find that a lot of doctors, they just rush you, and they don't even know your name. You're just another number. And with you, it's a total different experience. You get to actually know about the person, spend quality time with them, and get their needs physically, emotionally, and it's a totally new thing.
Right.
It doesn't exist anymore, and you're bringing it back.
Absolutely. I mean, I hear horror stories where patients say to my physician, they weren't even looking at me.
They didn't even touch me.
Right. There was no examination. They were just looking down, or looking now today, it's looking into the computer and then turned around and says, well, here's your prescription. That's not
have a nice day.
Yeah, have a nice day. That's not a history and physical.
No.
So for me, a history and physical is actually I'm look, listen, and feel. I look, listen, and feel, just like CPR, right? You look, listen, and feel.
Right.
I look at the patient while they're speaking. And the reason why I do that is because your voice tells a story. The volume, the force, the amplitude. It's telling me a story. I'm listening to what they are saying. A lot of doctors, they're looking at you, but are they really saying, or they're clock watching? A lot of times, like, okay, I have 5 minutes with this patient. I got to move in and move out and get him. And so I have my next patient.
Right.
Not with me.
Yeah, meanwhile, there's 40 patients in the lobby waiting about an hour, 2 hours after their appointment time to see you. That doesn't happen with you.
No, no, not at all. And then you must feel your patient, okay? Feeling it. How do you feel your patient? Well, you have to do a physical exam. That's why it's called a history and physical. That's the physical aspect. Not only I feel them physically, meaning doing a thorough exam, listening to their heart, listening to their lungs, listening. A lot of people don't go, wow, my doctor's never done that. I listen to their carotid, so I put my stethoscope on their neck because I'm listening for carotid bruise. Doctors don't do that anymore. But not only, physically examining them, I am feeling them emotionally because the emotions tells a story as well. I give you an example. I had in my practice in Manhattan, I was treating a lot of patients that had a cancer. So I had a gentleman, he was in his early 60s, and he was just diagnosed with end-stage cancer. Hearing that, your whole world changed. Everything, your whole world just dropped out, bottomed out on you. So I can feel that. So I'm treating his side effects from the medications. And, I could see that emotionally he was hurting. He was in pain.
Sure, yeah.
He was really in pain. So what I said was, I stood up. I said, stand up. And he looked at me and he stood up. And I said, come here. So he came over. I said, give me a hug. So he looked at me and he kind of like me. I said, no, come on, give me a real hug. Right?
Yeah.
Give me a real hug.
And then surprisingly, yeah.
Right. So the guy gave me a hug. I said, there you go. I said, listen, I'm here for you. And he turned around and says, Doc, he goes, I want to thank you for that. I really needed that. So if you need that, that's the emotional component that's lacking in medicine today.
Very much so.
You're going to get that with us. Yep. Within my office, you're going to have that physical and emotional component.
Yep.
We always say the mind, body, spirit, or mind, body, soul. Biblically, historically, we know about the mind, body, spirit. You have to have that connection. You have that connection with your patient. You have that connection with the community.
I want to see one day when people are not afraid to go to the doctor, when they say, oh, I got my doctor's visit today, and they dread it. I want, when your appointment comes up with Dr. O'Brien, you'll feel excited to go to the doctor because you'll get a whole experience,
Right.
You'll be seeing an interesting day instead of something that's dreaded.
Right. So let's do a walkthrough. Patient comes into our office. What do they expect?
Well, first they see me, of course, Miss V. They get to meet me. And then I give them 2 pieces of paper. I make them feel comfortable, sit them down. They fill out the 2 pieces of paper, real simple. And then they do the walkthrough with you. And they get to see, the historic stuff that you have in the office. It's like a little museum to learn about, what the medical history is about. And it's very fascinating. And a lot of objects and stuff on the wall from 9/11, memorabilia and stuff like that. And it's a great walkthrough. And then by that time they reach your office, they feel comfortable. They sit down, then you talk to them a little longer, and then you go and do the exam.
Right.
And after the exam's done, they just feel great.
Right.
If they come out, we all laugh and talk again. And that's the experience, you can expect that. And I'll be there to greet them for you.
Exactly.
Yeah.
It should be going to your physician should be a positive experience. I had a couple that came to me last night, and I heard me last week on the air, and they said this is exactly what they were looking for, an affordable concierge service. They looked at other services, which was in Western Nassau County, which was too far away. And so one of the stories, they explained that I went in and I sat in the waiting room for over an hour, and I finally got into the exam room, and I waited another 45 minutes.
Oh, yeah.
Then the physician came in and only spent 5 minutes.
5 minutes.
5 minutes.
Yep.
5 minutes. Last night...
And he probably didn't even touch him.
Well, last night I spent an hour and a half with the couple, going over everything and having a nice exchange and developing the relationship. That's what this is about. It is a relationship. If you're not happy with your current situation with your physician, you're not getting the services you deserve. The doctor doesn't touch you, doesn't examine you, and just pumps medication. Here's a prescription. Come back in three months. There's no exchange there, no exchanges of ideas. You don't feel comfortable? Come and see me. I'm here. I'm here for you. I'm here to serve the community. I served my country proudly in the military. I was the commander of New York City. And now I'm doing the same thing. I mean, I've been doing this for over 20 some odd years, serving the community as a physician, but now I'm here in the East Patchogue community. Also, I'm a Mason. So for my Masonic brothers, we serve the community.
Yep.
So if you're in a former military, a vet, active, or you are a vet, you're a Mason, come and see me. Now, again, services are affordable. Very, very important. I'm here to care for you, take care of this community. So if you want to learn more about my practice, go to drtommyo.com. That's DRTOMMYO.com. If you prefer to stop by my office, it's located at 250 Patchogue Yaphank Road, Suite 16, East Patchogue, New York, or call 631-980-8200. That's 631-980-8200. It is the beginning of the year. It's time for a physical. Come on in, make that call. Let me help you lead a happier and healthier life.
Sounds good.
That physical is important. We need that connection. We need that bond. Give us a call. We're here for you.
Call us today.
Welcome back to the Ask Dr. Tommy O Show. The Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. Come join my practice. Let me help you lead a happier and healthy life. So part 2, we're going to discuss questions that were forwarded to me through my email as well as on various social media. We need to address this because a lot of patients were asking the same questions.
Yeah, they were. A lot of them came through the same way.
Yeah, same way. So let's go over these questions.
Well, let's see what we got here. The biggest one, I think, was about do you do pain management?
I do pain management, but I treat pain with medical marijuana. Patients are calling up because they want narcotics. I do not prescribe narcotics. Nope. Narcotics, we're talking about Percocet, Percodan, morphine, oxycodone. I stay away from those medications. A lot of doctors are staying away because of the DEA and the FBI and because of the pandemic and the abuse and the deaths. I'm not touching that. That's not what my practice is about. I treat pain with medical marijuana. I do very, very well.
Yes.
If you're looking to get off narcotics, see me. Make that call, and I will set you up with medical marijuana, and we'll get you off that really, really fast.
Definitely. Another important question was, what type of medical issues do you address?
Yes. Well, again, I am a residency-trained family physician. I'm an osteopath as an added benefit. So, the full scope of practice: hypertension, diabetes, high cholesterol, upper respiratory tract infections, urinary tract infections. If you have musculoskeletal pain, you're used to going to a chiropractor, I can, they say adjust. So I'll use that same term because you're more familiar with it. I can adjust your spine, your neck, your lower back. Also for females, this is overlooked in a lot of practices, but I do perform breast exams and I teach how to perform a self-breast exam and also do pap smears. So that's an added benefit. So full spectrum. All right, whatever walks through the door, I'm able to treat.
And how often can people come to see you?
As often as they like. This is an affordable concierge practice where you're able to come in as many times you want. If for $100 a month, if you need to see me 3 or 4 times that month, it's still only $100, and you're able to see me 4 times a month.
And that's why I want to compare the experience in the past of people with other doctors is that you have to wait forever to see the doctor. You get in there and you only get to see him maybe once, and then he'll tell you come back in 90 days maybe. Right. Whereas if I had an issue come up in a couple of weeks, what do? I can't get an appointment. So with you, it's different. You get to see you as much time as you want.
That's correct. Let's go with some real figures here.
Yeah.
The average wait now is 6 weeks to get into see a physician. So if you go 6 weeks out of the year, you're talking you can only see a doctor maybe 8 or 9 times a year. Well, if you can't get in to see a physician, what do? You run over to an urgent care center, and that's out-of-pocket $90 copay. Well, for $90, for $100, you have me. And by the time you're done, remember, they're a business, and they're always looking to upsell and to push procedures on you because it's a business, not with Dr. O'Brien.
No, and besides coming into the office to see you, how soon can I get an appointment?
Yes.
That was another question.
How soon?
Do I have to wait a year to get an appointment?
Yeah, no. Again, my practice is limited, so between 3 to 350 patients. You want to be my patient? Make that call today, and I will get you in. If I can't get you in the same day, it's going to be the following day. If I have to stay late, I will stay late to see you.
And then another one was, how would one benefit by being your patient?
This is important. Yeah. Now, this is where you're going to compare me versus
to the other doctors.
To other doctors, so very, very important. I provide compassionate care. Every patient is like family.
Yep.
I'm born and raised on Long Island. Therefore, I understand the needs of Long Islanders.
Yep.
I'm a former military commander. I served my country proudly, and I continue to serve our community as a physician and as an executive director of my non-for-profit organization. We offer food and clothes drives. I also provide lecture series, so I would go into the community and I would discuss health-related issues. I also have a 4-time Beta Award TV show. It could be seen on youtube.com/Dr. Tommy O. Or if you go to YouTube and you put in the search Dr. Tommy O or Dr. Thomas O'Brien, it will bring up my channel. Mm-hmm. And you'll see the years of shows, not 1 or 2 shows. I have several years worth of shows, and actually you can see when I had hair, and then as I was starting to slowly lose my hair, and now I just buzz out, right?
Yeah, basically.
you see that transformation.
Yeah.
So you got to make it fun. Again, I'm residency trained in family medicine, and I rotate through all different disciplines, which gives me a well-rounded background. I am not a GP. A lot of people say, oh, you're a GP. No, a GP, general practitioner, did not do or enter a residency. They did 1 year postgraduate training, and that which called an internship, and they went out to practice. So they don't have the same
experience what you experienced, right?
Exactly. They don't have the experience where I rotated through all different specialties. That's why I'm able to treat. My spectrum and scope of practice is much broader.
I think also a main point about you is that you're an educator and that you are caring and
Right.
want to care for the community, just like our nonprofits help and lift.
Right.
We want to educate and communicate. And that's such an important thing because the world is a very ignorant place right now. A lot of people don't understand certain things. They're scared.
Right.
There's a lot of changes from COVID and stuff like that. So we're a whole new world.
Right.
So by you providing the compassion, the education, the main thing, education, your health education to the community, to your patients, that you just explain something to somebody and give the time to explain it to them, it means a world to people.
Right.
When you take the time.
Right. Put a smile on their face. Make them feel
Right.
comfortable. And that's that relationship. We're building that bond.
Make them feel important because,
Right.
we deserve to feel that way.
Exactly.
Well,
that's what you come to a physician for. For that well, we keep using the term compassion, but
Yeah.
you're going there because you're going to explain issues. I'm going to know things about my patient that their significant
Nobody else
other.
will know.
That's right. Their significant other doesn't even know. So you have to have that trust, that bond.
And it's confidential.
That's right. Everything's confidential.
I've told you some things.
That's it. Again, a well-rounded background and able to offer. I spend a lot of time in education. So you have questions, I'm going to spend time.
Yeah.
I'm also an inventor. I hold a patent for callus shaver. Now, if you know the peg egg, that callus shaver, well, that's my idea.
Yep.
That is my concept. Just that a company came in and they were able to modify it a little bit, and they sold, I think 6 years ago, 500 million
500
units
million.
times $12. So you know what that
A
number
lot.
is.
That's
Several
a lot.
billion.
Yeah.
Yeah. I got 0 out of that. I'm an author of a 2-time certified Amazon bestseller. I'm a medical consultant for major media outlets. And again, we spend time educating my patients. It's a no-rush office visit.
Yep. I think maybe the other day I saw you have a patient and you asked me how long was I in there. I said, no, you're regular, about an hour, 45 minutes to an hour.
Right.
I've never experienced that with a doctor, ever.
Right.
Ever. And it goes by and smoothly. It doesn't drag out. Well, you don't want to get it. Well, you don't when you want to run out because it's taken too long.
Right.
It's actually a great experience that goes by wonderfully.
Right, exactly. We, I want, you have to embrace your patient, and it has to be an equal exchange. And if you're not there, you're not accepting. If your back is to them and you're staring into the computer, there's no relationship.
No.
You're not hearing the patient, not feeling the patient. The other thing is I have written and video testimonials. What physician do you know has written and video testimonials? So if you go to my website, drtommyo.com, and then just click the button that says testimonials, and there's a drop down for video testimonials. I mean, I had patients putting their information out there to help educate the community and discuss their issue and how I help them. I mean, how many people do that? Who's willing to put themselves out there? And I have several that's done that.
Yep.
So, Lord, we're talking about COVID.
Yep.
COVID real quick, because we have less than a minute to close out the show.
Oh, yeah, let them know.
A lot of patients, they can't get into their physicians because they say you need to be tested for COVID.
Yeah.
Well, not with my office. I have the rapid tests. If you're not feeling well, come on in. So for my patients, I will test you.
Yep.
You're going to be seen. I'm not afraid of COVID.
Yeah,
okay?
we don't have the long lines that everybody else has.
No. All right, so this concluded the show. I want to thank you, Ms. Fee, for being on the show.
Thank you so much.
So, to learn more about my practice, go to drtommyo.com. That's drtommyo.com. If you prefer to stop by my office, it's located at 250 Patchogue Yaphank Road, Suite 16, East Patchogue, New York, or call 631-980-8200. That's 631-980-8200. Come and join my practice. Let me help you lead a happier and healthy life. Oh, God bless you.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.